In Cuba, representatives of the World Health Organization and the Panamerican Health Organization have expressed confidence in the country's COVID-19 vaccine candidate, as well as their willingness to create mechanisms to facilitate access to the vaccine for countries in the region and the world. Our correspondent, Naya Rotado, has the story.
The Director General of the WHO, Dr. Tedros Adhanom, stressed recently the need to guarantee universal access to COVID-19 vaccines once they are available, for which the international body has launched the COVAX initiative, which will give access to some 170 countries, with the exclusion of the United States, whose government abstained from joining the project. Since the Cuban government has expressed its willingness to make its vaccine available to the countries of the region and the world, we came here, the PAHO headquarters in Cuba, to learn about the details of these mechanisms.
Through the mechanisms that are already being defined for access to this vaccine, through the COVAX mechanism, as it is being called, where the WHO, in coordination with Gavi, the Global Vaccine Fund, and CEPI, which is a coalition that is supporting the production of vaccines, there will be agreements with countries in order to ensure access to these vaccines. This is the distribution mechanisms that the countries of the region, countries of the world in fact, will be able to apply in order to guarantee at least 20% of vaccines for 20% of their population.
Leaders of the Finlay Institute for Vaccines have presented the progress demonstrated by the COVID-19 vaccine candidate, Soberana 01, whose clinical trials in humans started on August 24th and have shown encouraging results for the scientific community of the island.
Once the vaccine is defined, we wanted to have successful results. That's what we want. Once the vaccine is authorized by the WHO, it will be a vaccine that will go to the revolving fund of the region. The revolving fund for vaccine procurement, as it is called, is the purchasing mechanism that the Panamerican Health Organization has had over 40 years. Most of our countries, including Cuba, are part of the revolving fund. So once the vaccine is certified, it will be available through the Panamerican Health Organization's revolving fund, which is what we want, and for populations in our region to access its production. Hence the importance, the joy that we have in the region that Cuba has a vaccine candidate, and even a second candidate on the way, so that we have the availability of a vaccine produced in the Americas region.
This September 11th, once its phase 1 is completed, the vaccine candidate will enter the next phase with a sample size of 676 volunteers, including the 40 from the initial period. The research should be concluded in all its phases in January 21, and it is expected that the vaccine will be ready by February and available to the 11 million Cubans on the island. And later, with the support of the WHO and PAHO, it will be made available to the peoples of the region and the world.
Naya Rotado, TeleSUR, La Habana.